Hello, my name is Marla Neufeld, and welcome to the Surrogacy Space. Today, we are joined by licensed clinical psychologist Eva Benmeleh, and she is going to share her really wonderful and unique experience in her specialty field of psychology and how it interplays with infertility issues and perfectionism. And it's a topic that I've never dived into before with this specific subsect. I just first of all wanted to say thank you, Eva, for joining us today on the show. I'm so happy you're here.
Thank you. It's my pleasure to be here. So excited.
Yeah. Yeah. I mean, you certainly have a really interesting approach to psychology. And I just thought it was really amazing that we could share it with our listeners. So I just wanted to start off with a little bit about you, like what brought you into the world of psychology and to specify your focus into the concept of like perfectionism and maternal mental health.
Yeah, a lot of people ask me that. I think whether or not I had ended up becoming a psychologist, it's always been in me since I was a little girl.
Cool.
I, I would sit around the dinner table when family was over with the adults listening to their stories, and I'd be the one that would make some people laugh or help them feel better when they were going through some tough times. And I was always the friend that had some sort of wise wisdom to share. But the reality is that I really wanted to understand the depths of the mother-child relationship. Growing up, I didn't have a good relationship with my mom, and I wanted to analyze it through the work and through relationships of other people with their parents. I wasn't aware of that though when I was in undergrad and graduate school. It only came much later. And through my own personal work and my learning about maternal mental health and infant mental health, I really started to understand what my quips and my qualms and all of the fighting and whatever that was coming up was really just really terrible bids for communication and connection. And undoing that has been one of the most beautiful and heart-opening practices that has benefited my relationship with her, my relationship with my own children, personally and professionally, just being one of those people who can help others truly connect to the ones that they love the most.
That's really amazing. The fact that you can grow personally and professionally at the same time is
Yeah.
a really magical thing.
Yeah.
So, what are some of your techniques? Like, I know I've read so much about this perfectionism concept, it's something I've never really heard about in a therapy context. So, how does that concept and others that you use relate to issues with like infertility and, issues surrounding pregnancy and things like that?
Infertility, pregnancy, that whole aspect of a woman's life is so delicate. And there's such a fine line between doing it right and following all the rules and guidelines and regulations versus following your heart. A lot of times for women who are going through this stage, because it's by choice, they feel this guilt that they're not good enough. Somehow they've done something wrong.
Yeah.
Somehow they aren't doing everything exactly how it has to be. Um, and so they get lost in the overachieving, in the overanalyzation, in the hyperfixating of the details, because a lot of times it's so nuanced and so important that they kind of just lose track of what it is that they truly want and what is, if they're in a relationship, what it is that's most important for that partnership as well.
Hmm. I mean, what therapeutic ways does one overcome that? I mean, me being, and I can relate to that concept of feeling like things have to be perfect. How does one get over that or
So
work on it?
yeah, so earlier today I was actually reading an article about the positive aspects of perfectionism. And this is what
Okay.
I tell people all the time, right? Because in the beginning of my own personal journey, I used to think being a perfectionist was a positive thing. And then I came to realize actually how it was so detrimental to so many aspects of my life. So then I thought, okay, well then I have to get rid of it. And it's none of that. It's learning how to integrate it. I tell people this all the
Mm.
time. You want your medical professional, your doctor to be a perfectionist and a surgeon to be a perfectionist, the architect to be a perfectionist, because there's a lot on the line with the details. So if they make a mistake, the consequences are huge, right? And so in the
Yes.
same thing with ourselves, we're not just going to throw ourselves into any situation because we don't want to look or feel or act like we're being too nitpicky. Some things are really meant to be hyper focused on.
Mm.
So the work is learning how to differentiate what's your intuition, what's your heart, what's your inner truth versus what's a belief system, a judgment, or something that's been put upon you because of some difficult, traumatic, or scary experience. And
Yeah.
that whole process, for many of us, especially if we are high on that perfectionistic aspect of personality, is its own therapy because many times we stop listening to ourselves for the sake of following along or being the good girl or the one who makes sure everybody else is okay.
Mm. Sounds like a lot of work to put into that if someone's so established in those ways.
Yeah, it is.
So I read on your website you have something called the perfectionist reset. Is that like your technique or like a set of counseling sessions? How does that work? What is this reset that you do?
Yeah, so the reset in and of itself is a 90-minute session. And so that's for someone who's already been in therapy and they're looking for a sort of synthesis of what they've already worked through. They want some clarity that they're not necessarily getting. They're stuck in the process of some sort of change or decision that needs to be made, and they're looking for a roadmap to get there. For some people, that's actually the opening to a more in-depth type of therapy, which is the 3 month or 6 month type of work that I offer.
Okay.
Where we're going into more deep dive, but clear focused strategies and therapeutic understanding of where you're at, what needs to be shed, and what needs to be revealed for you to feel more in tune with the big decisions or lifestyle that you're looking to make or have.
Hmm. And is your practice mostly focused on certain types of clients, like mothers to be, infertility? Like who are your typical clients that you're helping?
Yeah, it's a combination both of men and women.
Okay.
I really enjoy working with men, despite the fact that my background is in maternal mental health and infant mental
Okay.
health. But perfectionism is a big one. It's a lot of masculine energy. So
Mm.
the type of client that I work with is someone who's very aware. It's not someone who just keeps thinking that, oh, they have poor luck. They understand that they have something to do with it, but they're stuck in the insight. They're stuck in reading all of the books or going to other therapies that just keep asking them, well, how does this make you feel? And they're looking
Mm.
for someone to call them out in a gentle but firm way. Hey, this is your role in it. And what are you going to do about it? Because this and this is at stake. You might sense it, but maybe you don't know it.
Mm.
So the person I like to work with, and the people that typically like to work with me, are those who want that one-on-one relationship where I'm not the perfect therapist who has it all together. I don't pretend to be, but I am
It's like
someone.
you're teaching about perfectionism. It has to apply to all of us.
Oh yeah, well, because in the beginning, a lot of people had these fantasies that I had the perfect life, the perfect children, the perfect everything, and it wasn't until, and they teach us in grad school and throughout the trainings that you're not supposed to really talk about yourself. But
Mm.
I've learned
Interesting.
through, yeah, through the experiences, I know it's okay to share when it's tactful and it's with permission, um,
Right.
of what you go through. Yeah.
So interesting. And I think it's just such a helpful thing to kind of take a step back and realize that you're not at fault and it doesn't have to be perfect because that's not how life works. And I've learned just becoming a mother, like you have to let go of a lot of things, like in becoming a mom and actually being a mom. It's like the things you have to focus on change a little bit
Mm-hmm. 100%.
and not to beat yourself up too much about it. So what is like the biggest challenge you see to someone that comes to you for help? Like what is it that they resist the most or have difficulty overcoming?
Opening their heart. Uh,
Hmm.
because once you open your heart, you understand from so many levels, not just from here, but through somatically, the body, the heart, everything, what everything that's happened to you is really all about. And it's not to bypass the pain, and it's not to bypass any of the struggle. It's to understand, okay, life isn't happening to me. I have accountability, I have agency, I have a choice. I can look at my actions and, like you said, beat myself up over it, or I could learn from them, accept them, and pivot to something that just makes more sense. So I walk further and forward instead of keep tripping over the same stone.
And
And for
like the
that,
dwelling concept, like I know for me, like I'll like replay the thing
yeah.
in my head and like you have to move on from it somehow.
So both, right? When we're replaying, because I at this point in my career and my personal life, this is what I believe. When the mind and the body keep replaying and rehashing, it's because we haven't gotten the lesson yet. We haven't learned. And
Interesting.
yeah, so it's not to beat ourselves up. Why do I keep replaying this in my head? It's what aspect am I missing? And
Hmm.
usually the aspect is, okay, you did the best that you could with what you had.
So the replay is actually maybe a benefit. It's like replaying it for you to get the lesson out of that.
If you use it in that way, if you use
Right.
it to
Right.
punish yourself
To
over and over,
spiral.
yeah, then you're stuck, then you're in a loop. But if you look at it like, "Oh, okay, this is reminding me of not just that moment, but this is where the therapeutic container really helps," because like you said, we can loop into it and then cause more harm than good. But when we're looking at it like, this is a reminder of something I've gone through in the past, and I remember feeling this way, and I remember that's what I did to help. Well, maybe I can try that again this time. And if that
Right.
doesn't work, then maybe this is an opportunity to try something else or ask for help or, whatever the case may be, which I think comes up a lot with surrogacy and infertility and all of these challenges.
Oh, for sure. And I think this would be an invaluable counseling for people that just need like a little bit of a different, I feel like it's a very proactive approach to making change and overcoming the difficulties that are involved with this process. How do clients work with you? Is it virtual sessions, in person? How do you work?
Yes, for now, the sessions are virtual. I plan on offering workshops that will be in person later on this year, but now my sessions are virtual.
Cool.
Yeah.
And is it individual sessions? Do you do joint sessions for couples? How does that work?
Both are always an option and available, depending on
Okay.
the client.
Awesome. And what is the best way for anyone seeking your services to reach out to you?
They can go to my website, they can send me an email, or they can just directly call me and we can put that information afterwards, I believe.
And I know that you offer different types of services, like lengths of time, but is this something that someone could just meet with you for like an initial consult and get a sense if this would be an effective method for them?
100%, that's what the reset would be for.
Okay, wonderful. Well, this was so interesting. I mean, you gave even me in this short time a really cool insight to think about with the replay and just thinking things through and a different perspective. So I just so appreciate your time and the work you're doing to help other people.
Thank you. Thank you. Likewise.
And thank you. We're happy to share with our listeners all the information on how to reach out to you for counseling sessions. And I really appreciate your time. So thank you.